All right, Dr. Momin, I think we should just start from the beginning.
Yeah,
Let's peel back the clock around when you were in college,
yeah.
and we notice how every career has a lot of different inflection points.
Hmm.
Could you describe your journey towards dentistry and ultimately what led you to choose oral surgery?
Yeah, I mean, my path is a bit off-road or off the beaten path. Moved here in 1996 from India. Family and I settled in Atlanta. We had, we went to undergrad at Georgia State, and I was bouncing around what major to do because I was one of the first ones to go to college from my side of family in America. So at that time in 1990 or 2001 when I started college, computer was a big boom. So I ended up choosing computer science as my major. Did that, took a couple of classes, and I really realized that I'm not really good at that. Realized it pretty quickly. So then I bounced around and I was like, okay, I like cars. So I ended up choosing mechanical engineering. I liked it, but it was just too much of the math side of things that I wasn't really into, and it didn't excite me. Then I took my first chemistry class, which is a weird thing because most people hate chemistry, but I really loved it. I loved the artistic side of things like organic chemistry. Like you can create something out of nothing or mixing two things and you get something else. So I really liked that free form nature of the field that if you want something, you can create it from basic materials. So, um, ended up doing chemistry as a major, and then I also did my master's in organic chemistry. Um, did a lot of research during undergrad, and then I moved on to doing a 1 year master's instead of two, and that helped me get it set for dental school. Went to dental school at New York University at NYU. Was there for 4 years. Didn't know what if I wanted to do um, oral surgery or not. My biggest goal was to one enjoy New York City because I'll never get so did that, and then after I took my part 1 of my boards, I had pretty decent scores. So then I was like, okay, let's specialize. And then I really liked the openness of oral surgery, or really liked the wide scope of oral surgery. You can go from pulling wisdom tooth to cutting somebody's neck. Like such a big variety that no other dental specialty offers. So I really pursued that, and I went on to do oral surgery.
Awesome. I think we can dive a little bit deeper more on when you were at NYU
Yeah.
and specifically, was it in your third or fourth year where oral surgery almost became a reality for you? Like, when was the
Yeah.
point where you were like, I'm all in on this?
Yeah. So, first year of dental school, I was like, let's just get good grades. Let's just figure out structure, organization, because dental school, it's if you can master your own self personally, meaning you're organized, you can keep things organized and you can study in an organized manner, dental school is not that difficult. It's I my professor used to say it's like drinking water from a fire hydrant. It's literally all the things that you've seen or you've heard or you've known about an undergrad, but now you're getting all of it in about 2 weeks time and you have to take an exam in that. So if you can figure out yourself on how you study and how you organize yourself, um, and if you follow that regimen all through 4 years of dental school, you'll come out at the end pretty successful. So figured that out the first year. Second year is when I was like, okay, let me dabble into some specialty. Let me just find out what they are. So endodontist would appeal to me at that time, which I could never see myself doing anymore. Um, and then oral surgery. Oral surgery residency or oral surgery residents, they're taught basics, meaning they're given just instruments to be able to treat something. I really like that it helped me put in my input on how to do things more efficient way than what I was taught or I was told. So it's like it's more so they teach you, okay, you have to do this steps, but yet there's so much modifications to that that you can do to be able to achieve that. And I really like that wide scope nature of things and stuff like that. But yeah,
Absolutely. It's a very cerebral process as you
yeah,
enter the niche field of oral surgery. And
Yeah.
I think that leads to a very interesting question, and it relates to your residency.
Yeah.
Could you talk a little bit about your residency? What led you to choose you electing to train in Chicago,
Yeah.
and just what that experience was like?
Yeah, so the residency, for people who don't know oral surgery residency, there's a two tracks to it. There's a 4-year track and a 6-year track. The 4-year track and 6-year track, the only difference between the two is one gets an MD, the other one doesn't get an MD.
Okay.
The training in oral surgery is exactly the same for both residents. Um, a, a so I chose the 6-year route mainly because at that time when I was applying to oral surgery, I was thinking of doing fellowship or having that option open to do fellowship after the residency is over. And if you have an MD, it kind of gives you a little bit more weight to be able to get into certain fellowships. So that's why I did the 6-year. And also, I like I like to be able to know everything. And it just makes me a better surgeon to be able to take care of a patient who's more medically compromised and be able to understand, like, okay, they had this and I can quickly decipher, okay, this medicine is probably what they're taking, or if I need a medical clearance or not, and stuff like that. So I really liked, and I'm happy that I did the MD route, and it really helped me now working as an oral surgeon to be able to treat some more medically compromised patients.
So this is more of a question I want to ask you
Yeah,
because obviously I've never lived there, but how was Chicago during
yeah,
your residency time? Who
yeah.
was Dr. Momin
For sure.
outside of his very, very long hours of work?
Yeah. So I had the, what do you call it? The pleasure to live in New York City and also Chicago. So I always say New York City is for the 20s and Chicago is for the 30s. The main reason is that Chicago, it's 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 very different than New York City in a sense that New York City, you can walk everywhere, you can get anything, you can do anything, and you never need or even want a car there. Like you can take take a subway or you can take a Uber anywhere, and it's fairly close by. And you're kind of stuck in this small bubble for 4 years, and you only see maybe half of the island that you're living on. Um, but Chicago, the cool thing about Chicago is that it gives you that feel of suburbia, but in a city atmosphere. And I really like that. I really like that I have a car. I can do my own things. I can go to Costco. I can do a lot of things that I wouldn't be able to do in New York City. But Chicago, 6 years for me was a haze because residency doesn't give you any time to be able to enjoy completely what the city has to offer.
I think you brought up a super relatable point about Costco. That's something that I found recently in my life, and
Yeah.
it's been a game changer. How do you feel about HEB now that you're in Texas?
Yeah, it's I think HEB is a game changer.
Oh,
I think every city should have HEB
oh
just
wow.
because of the ability to be able to get whatever you want in one store. It's amazing. And Costco does the same thing, but some people don't have memberships and it's very stringent on who can go in and not. Well, HEB, anybody can go in.
Are you a fan of the Costco pizza?
Dude, it's the best.
Do you think it rivals Chicago pizza
Uh, that's tough.
or even New York
I think
pizza?
you got to be in the mood for it. I think Chicago pizza is great, but it's you have to be in the mood for it. It's so heavy, and it's so you better not have anything to do that day or the next day
Yeah,
because it's gonna
entering a
take
food
time.
coma
Yeah, it's
is what
called
I like to
rest and
call it.
digest for a
Yeah.
while.
Uh,
But yeah,
wow. So you mentioned an interesting point about the patient population that you
yeah.
faced while you were in Chicago. Could you describe how that was different from when you're training in New York?
Yeah. So with Chicago, the unfortunate part of Chicago is that there's a lot of crime. People who train in these type of facilities or hospitals, they get to see everything. Like we've seen kids who've gotten shot at 12 years old and had gunshot wounds and almost paraplegic, and like it's the amount of experience you'll get as a resident in a Chicago hospital is unmatched. I'm not saying that New York probably doesn't have, I don't have the experience, I can't speak on it, but as far as Chicago goes and as far as what my training is now outside of residency, I feel like I was well prepared to be able to treat
Mhm.
patients and treat any kind of emergencies.
Absolutely. We learned that residency is is a time to train your technical skill set.
Hmm.
But oftentimes, some of the most valuable lessons are the ones that challenge you both professionally and personally.
Hmm.
As you mentioned, you saw some pretty traumatic things for some people. Could you
Yeah.
describe an experience that you had that you felt enabled this trait in you to really help you connect with patients?
Yeah, so I was on trauma. The third year of residency. We rotate through trauma. We do night calls. So one patient walks in. So usually what happens with trauma is like you get a code, your pager goes off saying that there's a code. Um, Patients coming in, gunshot wounds or got hit by a car or whatever the case may be. This time we were just cleaning the the room up because we just had finished one emergency. Then all of a sudden, this patient just walks into the emergency door. Hi- His face, I can't forget it. His face is literally hanging, and you can see the eye outside of the face.
Oh man.
So the when he walks in, he's able to talk, but he can't because his jaw is broken. It's pretty much in two pieces. We bring him back. The I remember the nurse saw it. Nurse started saying code, code, code. So we all go. We I had I had I had to intubate the patient awake, so we to secure the airway. At this whole time he's talking, and the thing that he said that resonated a lot is like, like please save me. Like, do you think I'll be okay?
Wow.
And those things, those words at those moments are very powerful, and it makes you really think about what you're doing. Because I think it's very easy to get lost in residency and dental school with taking exams or treating patients. You forget what you're there for. And when a patient who doesn't know you but he trusts you with his life, it really puts in perspective of what you do and how you do it. So um the yeah, so that was pretty moving for me to be able to continue what I'm doing and to be able to give like the um, reality to a situation that residency is not just a cookie cutter. It's actually you are getting into the field and you'll potentially graduate and work where a stranger will trust you with their life to be able to put them to sleep, to take their wisdom teeth out or take a tooth out or do a cancer case. So
Absolutely.
it's literally it's a big powerful thing that you're getting as you graduate residency that a lot of people don't take into account.
Absolutely. You feel you're almost entrusted with this responsibility, and the gravity behind these
Yeah.
experiences um, are more than just doing a procedure. They almost take an emotional toll.
Hmm.
Uh, to add to that, could you describe how some of these experiences ultimately framed your philosophy on patient care?
Yeah, I mean, I think as you grow in your profession or as you grow outside of residency and in real world, um, you realize every patient puts some type of stamp on you. Like whether that be one patient who's so grateful that now um, he's pain free from a impacted wisdom tooth, or if it's somebody that all they want to do in their life is to be able to eat a pizza and bite a pizza off, and so,
A
this
Costco pizza.
a Costco pizza, yeah. So I actually have one patient who we're gonna be doing surgery on that has we're doing orthognathic surgery and they have a bottom jaw is it's called mandibular hyperplasia and maxillary hypoplasia, so that they have a dental like a skeletal facial deformity,
Hmm.
so they aren't able to close com completely and like teeth touch. So we're going to do orthognathic surgery where we kind of break the jaws and bring it together into a position that they have a good occlusion and good function, and at the same time you achieve aesthetic concerns that you address bec- and give them a more um, more facial harmony.
Hmm.
So yes, I think every patient leaves some type of foot. like a stamp on you. Either that be small or that it can be life changing, like that person. So
Absolutely. I think it's interesting that you talk about this imprint left
yeah.
because it seems to me in the private practice world you don't deal with as similar cases as you did in your residency in
Hmm.
terms of the
Yeah.
in terms of the trauma
Yeah.
cases. When you graduated from your oral surgery residency, could you talk about that first job you took afterwards and what that transition was like?
Yeah. Traditionally, when I graduated in 2018, the traditional oral surgery route is that you graduate, you finish your residency. In your chief year, you start looking for jobs, and 80-90% of the time it's like you become an associate with a private practice group, and you work there, and then there's a path to partnerships over 3 to 5 years, and then become partner after 5 years, and that's kind of how that lays out. So when you graduate from day one, everything is taken care of. You have insurance, nothing to worry about besides just doing surgery. I didn't take that path. um, I took a path of least resistance. um, the the main reason I didn't take that path is, one is that I knew the first 2 to 3 years would be hard to be able to do it on my own or to do something that's like an independent contractor gig. Um, but I knew that the fruits will be served 3 to 5 years after that.
Okay.
So I ended up joining a traveling specialty company, where we would go to dental offices doing surgeries. It's a difficult route when you start out because, one, the things that you take granted for in residency, like consents, like making sure you have gauze, like the little things that you never think about. It's just there in a drawer at your residency. Now you have to think about every little minute details, um, all the way down to like a consent form, or even like a instruments that you're going to use on a tray. Everything you have to think and you have to provide, to be able to create uh, enough things in your room to be able to do a surgery. So
Absolutely.
um, it was a bumpy road the first 6 months, but we got a groove of it. We got everything. We got settled, and then I've loved it ever since. I like the traveling nature of things. I don't, um kind of hypocrite now. I have my own practice, but I really like that every day I go to an office and it's a different office and it's a different environment and it's a different challenge to be able to do things that I didn't do yesterday in the
Mhm.
same area, in the same environment per se. So like that. So that's the job that I took. Ended up just being self-employed and then did independent contracting work.
Amazing.
Yeah.
I got excited while you were speaking because I feel like I unlocked three more questions from you. Let's talk about the time you were given back.
Yeah.
You mentioned in your previous answer about residency
Mm.
how you were in Chicago, but you didn't necessarily get to enjoy the city of Chicago. Now that you were an associate or you
Yeah.
were an independent contractor, what did you do with that time you were given back?
Yeah. I mean, I think it is a big difference. If any one of you guys is a resident is about to graduate in July, like it's insane. You feel like you're not doing something because all of a sudden you go from 14, 16-hour days with somebody to report to and so many things going on the next day. All of a sudden everything just stops, and the only thing that happens is that you go in at 8 o'clock, do surgeries, and you go home at 5 p.m. And then for most people, there's no calls, there's nothing to, nobody to technically report to, and you're home and you're sitting at 5 p.m., which is a regular work day for most people, but for residents, that's not it. So all of a sudden, you have from 5 p.m. till 10, 11 p.m. of nothingness,
Of just free time.
free time. So you're like, what do I do? The first 3 months that I was out, I was like, I don't know what to do. So I was trying to figure out who I was, and I was trying to figure out what I liked, and I was trying to figure out how can I make use of my time.
Amazing.
So that's it's something something to get used to, but you get used to it quick.
Okay,
Yeah,
great.
yeah, you
Yeah.
forget residency pretty quick.
Yeah,
So,
you're like, I have time now, I want to use it.
mhm.
So what did you end up filling your time with? Did you develop any
Yeah,
new hobbies with that time? Did you find
yeah,
yourself taking on more cases just because you wanted to work more? Like, what was it
yeah. I
like?
think my plan or my thing was when I graduated, I wanted to be a. I knew that as a surgeon, there's a lifespan.
Okay.
Okay, because of the nature of work, your back hurts, your legs hurt. There things happen fast. So I give myself 15 to 20 years. That's my lifespan. I need to do whatever I need to do in that lifespan, create whatever I need to create, and after that, I take a break. So those are the things that I spent most of my free time just kind of thinking about one, who I was, what I liked, and how I can um, grow as a person and as a professional.
Absolutely. Let's talk a little bit more about you being more of a business-minded
Mm.
dentist. What does that look like while you are working as an independent contractor? And when was the decision made to be like, you know what, this is a time I want to start my business?
Yeah, so I think as far as business minded goes, I think one thing that we lack so much, or at least from my experience and I can't speak for everybody, but for my personal experience, that I lacked in my education is that we were never taught what business was. We were only taught what medicine is. We were only taught how to treat a patient, how to take care of patients, and all of that stuff, which is a great asset. But I really wish in residency or in dental school or somewhere along that road there should be some type of business acumen. That should be a class, a semester, a year to be able to learn that, because when you get out in real world you're lost. Besides, yeah, you know how to do surgeries or you know how to treat patients, but outside of that you have no idea what to do. So learning that is a challenge, and it for me it was a lot of trial and error, a lot of learning on my own and trying to figure out what I want, how I want it, whatever that case that may be. But that's one thing that I wish residency instilled is some business classes, and it's a good asset to have when you get out,
Hmm.
to be able to understand your worth.
Of course, of
Yeah.
course. Did you find that experience or that education just by trial and error? Did you have a mentor that helped you? What did
Yeah.
that path look like for your own education behind what it means to start a business?
Yeah, I mean, I think we're my family and my background come from we're business people. Like my parents owned Dairy Queens, so we were in fast food industry. We always owned some type of small business. So
Mhm.
the instillment of owning a business wasn't daunting to me.
So you mentioned how when you're in a procedure, you like to stay focused. You like to keep the conversations to a minimum.
Yeah.
But let's say you're dealing with a patient who's very stressed out, who's very uncomfortable by
Hmm.
what you're doing, who feels that they can't go through with the
Yeah.
procedure. That obviously changes things for you.
Yeah.
How do you go about adapting to the environment that's in front of you and more so bringing your whole team back
Yeah.
to a normal state?
So when I say I don't talk when I'm working, I meant because most of the patients that we treat are sedated.
Okay.
So they're asleep, they don't know anything, they don't talk or anything like that. It's more so for my assistants or for my employees to be able to not interfere in what my focus is. But if the patient, let's say, is awake and we're doing wisdom teeth or whatever, usually what I do is I ask them, what is your comfortable level of what you need to know? Okay. Some people say, like, hey, I don't want to know anything, just do your thing and
Hmm.
that's it. Some people say, tell me each way what you're doing. So, whatever their comfortable level of knowing is what I follow. So if they say, and then I tell them, hey, like, here you go. We're about to give you a couple of injections. We're just gonna numb the area up so that way you don't feel anything. And then after that, then we usually have like set points where we tell the patient, like, hey, the tooth is out now we're going to do bone graft and we're going to close it up probably about another 10-15 minutes, and then we'll be done. So we don't say like, oh, okay, like we're going to make an incision now, we're going to cut. No, there's certain time frame where there's almost like a break between the next step,
Hmm.
is when we kind of inform the patient, like, hey, the wisdom teeth is out. Oh, hey, we're gonna put a lot of pressure now because we need to kind of wiggle the tooth out.
Hmm.
So they understand what's about to come and they anticipate it. So um, for those patients, yes, we do make sure that we follow whatever their comfortable level is to be able to have them feel less anxious. And as far as anxiety goes, that's the beauty of at least what I do is that we can offer sedation. We can offer IV sedation, so be able to for people who are anxious of surgery and don't want to hear the drill or don't want to feel any pressure, they can go to sleep for the procedure, and we'll wake them up once the procedure is done. And then almost all the patients love that type of service.
Absolutely. Absolutely. So this brings me to a new topic, which is as a practice owner
Mm,
and obviously someone who leads their treatment planning. What does treatment planning look like for you?
mm,
And from my understanding, there are two forms of acceptance. There's the sort of consent that we're talking about, which is our case acceptance.
hmm
And then there's a side of dentistry that not many people like to talk about, which is financial acceptance.
Yeah.
Could you talk about how you go about treatment planning and how you get those two forms of acceptance as you speak with the patients?
Yeah, I mean, I think the biggest thing about treatment planning is that you gotta treatment plan is just it's not just numbers. Oh, you need this wisdom tooth out,
Hmm.
or you need this tooth out, and that's it. In order to one get good case acceptance, and then in order for patients to be happy with what they're paying for is one, understand what their chief complaint is. Understand what they're there for, and understand what you're going what how are you going to make them better than what walked in with. If those three you understand, you're able to articulate to the patient like, hey, you need this because this is how it's impacting your life and this is how it's going to be better after the surgery's done. So you try to understand the patient, you try to understand, and every patient, no matter who it is, has that point where that's the only reason they came to your office. They didn't take a day off or from work or take time off from their busy schedule to come to your office to talk to you. Or there was a point that they reached and then you're like, I can't take it anymore. I need to have a specialist look at it. So us as a provider, we need to find that point or that reason that they came in, and patients are not like shy about telling you what they came in for. That's the first thing they tell you. Like, my jaw hurts. That's why I came in. Or my tooth hurts. Or my I don't like the way I look. Whatever the case may be, you know. And then now you create a treatment plan all around what their chief complaint was. And at the same time, and as far as the case acceptance goes, you reinforce when you're presenting the prices or financials how this is going to be a value add service for you from what you came in with and what you're going to get out of it. So you always keep that forefront chief complaint in the top of mind with treatment planning and with case acceptance. And that's the
Absolutely.
best way to get good case acceptance.
Absolutely. Now that we're entering a market where you can find dental clinics at every other corner in the city,
Yeah.
from a patient's perspective, why do you think they should choose OraSurge?
Yeah, well, I mean, I think dentistry is one thing, but oral surgery is a bit different in a sense that, um, personally speaking, it's good that there's dentists at every corner because that's a good referral source for us. But as far as between oral surgeon to oral surgeon, I feel like why they why why they should choose one over the other. It's not because um, I think the worst way to choose an oral surgeon is because one is cheaper than the other. I'm not being biased. The reason I'm saying that is that you want to choose a person in any field or anything you do that you feel comfortable with, and two, they'll be there when you need them again. And then three, that's the person that you're gonna call first before you call your parents, before you call your grandma, when you have pain again in that region. So you're not just buying a service, you're essentially buying a long-term relationship with that person or with that provider. So it's very easy to say like, hey, that guy next door charges $5 while you're charging $7. Why is that? You know, but that's because of the service that we're providing, and then that's because the materials that we're using, and two, if you are truly happy with that $5 service and you connected with the surgeon and you feel comfortable with that person, go with that. You don't need the $7 service. So at the end of the day, don't make a decision for your health because of money, because that will always come bite you back twofold. So be careful and choose somebody that you one connect with and you actually trust them genuinely. Tell me who Yusuf is.
Wow. I grew up in Dallas, Texas.
Mm.
I grew up in a family of five. I'm the youngest of uh, three kids in the family. Um, I grew up in the city. I went to SMU, where I majored in finance and biology, and now I'm at UT Health San Antonio, studying to be a dentist.
Mm.
Studying to be a dentist. It's been a unique journey, but
Yeah.
it's one that I'm happy to be on for sure.
Did a little bit of research on you.
Oh, really? We
So,
have. Okay,
yeah,
there we
just
go.
a little bit.
Just a little bit.
So, you you've had a good upbringing, but you've had a lot of diversity in that upbringing and be able to in more so in educational background, because at least correct me if I'm wrong, but you went to Islamic school first, and then you went into private school, and then that's the journey. So tell me a little bit about your educational background
Yeah,
and what led you from one to the other, and how was that
of
experience?
course. So as you mentioned, I started at an Islamic school. I was pretty young for my class. I was around a year younger than everybody. I started school at an earlier age, and there was something about a disconnect I felt.
Yeah.
I grew up in an Islamic household, and everyone, despite telling me that like I should stay in this institution, how everyone was pressuring my parents, this would be good for him. uh, I learned early on during that time that this school just wasn't meant for me,
Mm.
and that had nothing to do with religion. That had everything just to do with I just didn't. You know what? When you're young, it's
Mm.
important to have camaraderie with the people you go to school with,
Yeah.
and more importantly, I think, especially being someone who's extroverted, who actually derives energy from their social interactions, it just wasn't the place for me.
Yeah.
So the within the Dallas network, my parents really wanted to send me to private school. And private school in Dallas is typically um, affiliated with religion. So
Mm.
I went to a Christian school actually. So I
Yeah.
went from an Islamic school to a Christian
Christian
school,
school. Yeah.
and that was quite the scenario, especially being so young. And
Yeah.
I went there when I was around 10 years old, and I ended up spending the rest of my uh, elementary school, middle school, and high school years there. So 9 years total.
Hmm.
And it was quite interesting. I learned a lot about different faiths. I learned a lot about what it meant to be a Christian, and more importantly, I was lacking this identity that I seemingly had at home.
Hmm.
Everyone was different from me. Everyone was not from the same background as me. So I almost felt I went home a Muslim, but I came to school almost a Christian just
Christian.
because of everything that was
Yeah.
going on. And that really taught me a couple things.
Hmm.
I think intellectual curiosity is one of them.
Yeah.
Having different perspectives on what you choose to believe was extremely important to me, and I carried that with me to college. And being at SMU, not necessarily a religious university, but
Yeah.
that mindset of wanting to learn the same thing from different lenses was extremely pivotal in towards choosing what I align with, what my career trajectory looked like, and it opened up a lot of doors for me. So I'm actually really glad I had those experiences.
No, that's really good. And so I know your family a little bit.
Okay.
So 99% of your family is in medicine.
Yes, they are.
Why did you choose dentistry?
It's a good question, and a question I get often.
Yeah.
So growing up, there was the standard of success of what a good life meant.
Mm-hmm.
From my early ages, it was my father being a physician. From later in life to my older brother starting a business and running a business while doing medicine then became the new standard.
Mm-hmm.
And then my sister, who got so involved in the city on different boards, on ambassador programs, and just having an identity outside of doing medicine as well.
Yeah.
But the one through line of all of it was medicine.
Mm-hmm.
And I was very curious as to why. So when I initially joined my university,
Yeah.
I was like, I think I'm going to be a pre med.
Yeah.
And The one thing that I was sure about, though, despite being pre-med, was I was a finance major. And that opened up a whole new lens to viewing an industry like medicine, because people don't talk about that. Medicine is a novel career, but it's an industry like anything else, and industries have a lot of pain points and obviously a lot of strong points that work in their favor. So when I was a first year, I was an EMT, and I saw a lot of different cases, varying from gunshot wounds to stab wounds to, just any form of trauma that I was exposed to. And it's not that I didn't like it. It's just I didn't know if that life was meant for me. Like there was something missing that I didn't necessarily find through my quote unquote clinical experiences that I was looking for through shadowing. So I shadowed various different physicians, and there was still something missing. And when I entered my summer before my second year of university, I was like in a position where I think this may be the time to explore different careers. And so when I went to my mom with these concerns, she told me, why don't you shadow dentistry? It combines the business savviness you're looking for with the sort of clinical interest you have. And I was like, Mom, like maybe, I'm not sure. So I was like, you know what? I know someone there at a clinic nearby our house. Why don't I just go shadow them for a day? I'm on summer break. I'm not doing anything. So immediately I was shocked, mainly because I saw someone use their clinical knowledge in one half of the day and then shift gears entirely to the business side of what they were doing. And that was extremely compelling to me, how in dentistry, almost all clinics you see are private practice, meaning that there is some form of business ownership involved at every level. And that was an extremely strong point to me, because when you look at physicians, with the way that private equity has entered the realm of this industry, you're becoming a really strong, skilled laborer and less of a practice owner. And part of wanting to major in finance was that I wanted to have my own business one day, and understanding the language of it was extremely important. And I saw that not being a thing in dentistry, where I don't think that there will ever be a point where dentists aren't going to be involved in the ownership of their clinics. And obviously that's changing with the corporate clinic model and the DSOs, but there's always going to be a mom and pop dental shop that's been knowing a family for 20 years and that has a great relationship with all of its patients. And that's the kind of vision I saw for myself, and I ended up deciding to stick with it, and here I am now.
No, that makes sense. I feel like dentistry is 50% dentistry, 50% business.
Absolutely.
And if you don't have the other 50%, it's very hard to make it in this business. So
Absolutely.
let's say if you were to talk to yourself 5 years ago, before you decided medicine or dentistry, what would you say to yourself that would help you get to where you are today? And also, if you were to tell yourself 5 years from now, where would you like to be?
Wow, you're really putting me on the spot here. I think 5 years ago, if I were to talk to myself when I was 18, I think the number one thing that I would tell him would be that there are going to be a lot of people who voice their concern about what you're doing, who say to you that it's not going to work, and more importantly, say that you should be doing other things. And that the one thing that you should not doubt is the work that you put in to make a decision.
Nice.
Because oftentimes in life, I've realized that, like we all are the sum of our choices, and whether we choose to accept that or not, that's entirely up to you. But for me, I needed to accept that about myself, because college was a tumultuous time where I felt the doubt, but not from myself, but from other people leaking into my ship. And I would tell myself 5 years ago to really try and prevent that from happening. But from a perspective of looking 5 years forward now into my future, it would be that to exhaust all my options until I make the decision. I think the way I operate is I like to have choices with what I do. And I don't like to cut any avenue off in terms of my career until I'm really sure that I want to cut it off. And I've realized that in dentistry, people are pretty gung ho day one on doing specific things, and that's great for them. More power to them. But for me, I want to explore what it means to be a general dentist, an orthodontist, an endodontist,
Yeah.
periodontist, oral surgeon before I decide what the career path is for me.
Yeah.
Because I think it's much better to have an informed no than you just saying no.
Yeah.
And so for me, 5 years from now, I hope I can look back and be like, I
Yeah.
educated myself well enough to have the informed no.
Yeah. Always trust yourself on that decision, because at the end of the day, you will be doing it for the rest of your life, not
Absolutely.
anybody else.
Absolutely.
So it's
Yeah.
very important that, one, you like what you do, and two, you've exhausted, like you said, all options before you chose that, so you never feel regrets.
Absolutely.
No, that's really good. I think one of the things I feel like some viewers may be asking, they may be young, they may be in high school or college, and they're deciding in the same shoes as you,
Yeah.
who decided dentistry route, and now you're a second year dental student.
Yes.
How was that journey of application process? Because I mean, at the end of the day, getting into dental school, medical school, it's very tough. There's a lot of entrance
Absolutely.
exam, a lot of interviews, a lot of things that you have to kind of go through to be able to get in and be into a dental school. Like, that's a
Absolutely.
big achievement. So, what are some of the pitfalls that you would want somebody who's in that shoes to be able to avoid?
Of course. Uh, so from the perspective of someone getting into dentistry and someone wanting to learn more about it, let's say they're at the high school or college level, I think the number one thing that you should do for yourself is make sure that all the things that are in your control, you're handling in your control.
Yeah.
Whether that's the amount of time you're studying, the amount of shadowing experience that you're getting, or more importantly, you're truly evaluating what you want out of your career.
Mm-hmm.
Because with anything, I tell people who are younger than me, there are like 3 major decisions that you'll make in your life. Aside from your family and who you choose to be with, your career is the third biggest decision. And
Yeah.
for some people, it's even higher than that, maybe 1 or 2.
Mm-hmm.
And while I think I made a decision that was right for me at the time, people have different goals with their career.
Yeah.
And even though like I'm a dental student, the goals of my career are very different from my peers
Yeah.
who are also in dental school with me. So the number one thing I would tell them, and to avoid the pitfalls really, is to really understand what you want out of a career. And then make sure that all the inputs that are within your control, you are crossing your T's and really dotting your I's. Because when you're interviewing, when you are writing about what you are trying to convey to an application reader, it's extremely important that you sound like you are interested in what you're doing, and more importantly, you sound like you know what you're talking about. And let me tell you something right now. In the interview process, a lot of people can read through a lot of crap.
Yeah.
And people will call you out on it. And I've been called out on it. And that's a funny interview experience I'll say for another time. But I think when you know yourself, and more importantly, took the time to know it,
Mm-hmm.
then nothing can stop you.
Yeah.
And that's the advice I would give to both anyone in high school or college exploring this path.
That's a great advice. I think it will be of benefit for people who are applying or thinking about applying and
Yeah.
kind of going through that process.
Absolutely.
Okay, so let's get back at Yusuf. So,
Okay.
what's Yusuf's escape?
Oh, wow. What's Yusuf's escape? For me, sports.
Hmm.
For me, music. And third is food, man.
Yeah,
I'm a foodie. I'm a foodie.
you're in the right place for
Ask me
sure.
about food in San Antonio, I got you. Okay, I got you.
There are food places.
Oh
over
man,
there?
there's only food in San
Oh, I
Antonio.
see, I
There's only
see.
food. Charles Barkley was right, man.
Yeah.
Yeah.
That's
But
good.
I think escapism is. I think it gets more and more real as I've gotten older.
Yeah.
I think as life gets more fast paced, you kind of want things to help slow your mind down. And
Yeah.
for me, video games is huge. As much as I don't get as much time as I would like, I think video games have been great for me. Sports,
Yeah.
talking to my loved ones,
Mhm.
those kind of things just really kind
Yeah.
of help slow my mind down. And that's kind of been the truest form of escape. I started reading recently, man.
Yeah.
Yeah, just
Just
trying to get into random hobbies
getting
before life gets
getting
real.
into it. Yeah, yeah, for sure.
Yeah.
No, I mean, I think it's good. I think it's being able to escape is just remember that life where you are now compared to what will be 5 years from
Hmm.
now will be harder.
Absolutely.
So be true to yourself. Remember, escape is the only thing you have to be able to reset yourself when life gets hard, professionally or personally, and never sacrifice your escape over school, because school is not a sprint, it's a marathon. It's
Absolutely.
a long process. It's if you do specialization, it'll be another 3, 4, 6 years, whatever you decide. um, Being able to understand yourself and then the way that you um, work and the way that you plan everything around, it's gonna help you in the long run make everything else easy. So
Absolutely. What were some of your hobbies or escapes that you had like in dental school, and
yeah, I mean,
what are they now even,
yeah,
being a family man and
I
everything?
think I have more time now than I did before. So, yeah, I mean, I think I think escape, like, it's a generalized word, but that changes every stage of your life. Escape at 15 is different than escape at 20 as it is 20 to 30 or 40s, whatever it is.
Hmm.
So, es yeah, it's for me in New York City, escape was to one, try new restaurants, one, make new friends through dental school and through community because there's so many like-minded people and same age people in the city and kind of just enjoying city. I came from a small town called Conyers, Georgia, from us, and we escape was cow tipping and breaking mailboxes.
Yeah.
Okay, so and hanging out in parking lots at Walmart, but now in New York City, my escape was to be able to um, enjoy just the bright lights, enjoy the the hustle and bustle of things that I'd never experienced. Just kind of taking it in. And Chicago, the escape was to be able to just get some sleep during residency, which was a necessary escape. And then now, like now that I have more time, I got into woodworking during COVID, and got into cars and all these things that it's it suits me at this age because it doesn't require too much of my time,
Hmm.
and I can devote time to it whenever I please and doesn't ask for my time. So I
Absolutely.
like that type of escape right now. So